For Terumo, we are leading the way in development of new technologies that enable blood and cell therapies. Now, we may think that those blood and cell therapies are available to all. The reality is that this is not true. To give you an anecdote, did you know that in the US, out of 100 patients that are eligible to cell therapy, that only 40 of them are actually getting it? That means that 60 patients out of 100 remain untreated. It's the role of our patient access team to help overcome such burden. So what we see is that for patients to have access to Terumo PCT technology, there are a number of barriers to be overcome. One of them is the affordability of our devices. What is affordable to you and me may not necessarily be affordable to a patient, say in Kenya or Uganda or in Ivory Coast or in even other more developed countries. The other one is geographic access. In the US, based on where you're living, you're more likely or less likely to have access to care purely based on your location. Think about that. We don't want such a health inequity. We don't want that. We want to make sure that every patient that has a certain condition that can benefit from blood and cell therapies should have access to treatment no matter where they're living. Another one is health policies. Our patient access team is continuously on the outlook of changes from a health policy perspective, especially those that may disrupt the access to care for patients. It could be that, for instance, you have a change in the legislation on plastics, which may cause millions of patients not to have access anymore. We're on the outlook for those changes and make sure that our organization is ready to accommodate those changes when they come around. We are focusing on multiple stakeholders, but the main ones are the payers, governments and authorities, and medical professionals. Our medical affairs team is more oriented towards the medical professionals. Our market access team is more oriented towards the payers, and government affairs is more focusing on governments and authorities, obviously. That being said, our team is very diverse because every country is different, every legislation is different, every patient access situation is different. So we are building a team that can accommodate these differences locally, one by one. What we're doing in Brazil is very different from what we're doing in China, and this again is very different from what we're doing in UK or Kenya or US. Well, the main one is affordability. That's the main barrier. Then you have geographic disparities. You have cultural and ethnicity-related barriers to care, and there is also the economic and societal barriers to care that are also applicable. All of them are actually preventing patients to have access to the treatment that sometimes just could save their lives. In Kenya, we demonstrated what the added value of blood is in relation to maternal health. We showed that actually by providing blood transfusion to women that are suffering from maternal bleeding, it's not only a saving of a life, but it's also an economic benefit that comes along with that. This helped hospitals as well as local authorities to start pilot programs to reduce the amount of maternal deaths in specific hospitals in Kenya. I'm very happy to say that after 4 years, we're now seeing hospitals in Kenya that have the same mortality rates of women in Western European or in very much developed markets. They are actually sometimes even beating the records of the Western or developed world. So that makes me very happy to see. In Brazil, we now have the first the largest hospital in Brazil, the Rio Hospital, that has started after multiple years of engaging with them to provide treatment for patients with sickle cell disease based on red blood cell exchange, which we know is both relevant from a clinical perspective as well as from an economic perspective. It's only one hospital, it's a few hundred patients, but we know that the next step is going to be that other hospitals will follow, and ultimately there will be a national decision to take red blood cell exchange and make it available to all patients that are in need. The main goal of our team in the long run is to make sure that we can enable patient access faster than the growth of the market. I will give you an example. If the total cell therapy space is growing 20 to 30% per year, I would love us to enable access to care for patients benefiting from Terumo technology at a faster rate than that. If 3 to 5 years from today we can look back and say we have achieved that, I'm going to tap myself on the shoulder and say we did a good job. What makes me optimistic about our patient access organization is that I see it happen. I see the knowledge sharing happen. I see the efficiencies of scale happening by bringing these three functions together. I see people working and collaborating with other associates that they had not even met 5 years ago. I see new talent that is joining our organization with very limited experience, being coached by people that have 15 or 20 or more years of experience. I see the magic happen, and that's what makes me optimistic, and that's also accompanied by the results that we have achieved. We have achieved more patient access than we had 5 years ago. So it's tangible, it's measurable, and it's really making an impact on a patient's life every day.